In this interview, I'd like to welcome Edem Adika.
Hey, thanks for having me on, bro.
All right, thanks.
Yeah, and planning on applied emergency medicine. So hopefully that's what I'm going into in July.
What do you feel like getting all the way to this point, and especially getting through medical school, really drew you to the field of emergency medicine over all the other specialties?
Oh, okay. This is a great question. I've been answering this question every interview that I've been doing for residency. So I'll give you the residency answer, and then I'll give you the bro answer.
If I were to ask you to take maybe a word for to represent your first year, your second year, your third year, your fourth year in the program, what word do you think you would use for each?
There's nobody else, no other specialty. I mean, this is debatable, I guess. No other specialty that is equipped to handle those situations like emergency medicine.
Hey, my name is James Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey to become a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I have something very special for everyone who's watching, as we're about to get into a really great interview. And before we start, I'm just going to go ahead and introduce the person that I'm about to welcome to the conversation. So he holds a BS degree in biomedical sciences, which he received in 2020 from the City College of New York through the Sophie Davis School of Biomedical Education. He was an intern at the New York City Department of Health and Mental Hygiene. He was also a volunteer and mentor with a group known as In Arm's Reach, where he was able to dedicate time to providing mentorship to elementary and middle school students who were facing unique family challenges. He was a Sophie Davis CUNY School of Medicine Research Advisory Board class representative, a mentor in the Health Professionals Mentorship Program, and also the captain of the City College New York men's soccer team. And so, in this interview, I'd like to welcome Edem Adika.
Hey, thanks for having me on, bro.
I know I gave a bit of an introduction, but would you mind, for everyone who's listening to this podcast episode, giving us a little bit of introduction to yourself?
Yeah. First of all, thanks for having me on, bro.
Of course.
I think it's great what you're doing. I said it before. I feel like I'm on Jay Leno or Jimmy Fallon or something like that. But
we're not there yet.
Yeah, it's great, and I'm proud of you for this podcast.
Yeah, thank you. Appreciate it.
So just a little bit about myself, like you said. My name's Edem Adika. I'm a fourth-year student at the CUNY School of Medicine, graduating this year. So I'm at the end of the line, end of the road.
Congrats.
Thanks, bro. Thanks.
Clap it up.
Yeah, and planning on applied emergency medicine. So hopefully that's what I'm going into in July. Originally from Queens, moved to Harlem for school. Both my parents are from Ghana, West Africa. Child of immigrants, and happy to be here.
Yeah. So first of all, congratulations. Again, just being able to apply to emergency medicine, huge accomplishment there. That I definitely want to get into a little bit later.
Thank you.
So in terms of all of this, and I know you just stated some of the things you're able to achieve and some of the background you have, what ultimately got you to the point of where you're at here now? Like, what got you interested in medicine in the first place?
Yeah. So I feel like all of us, well, not like all of us, I wanted to do medicine since I was like 5 years old. But I think one thing that solidified it for me is I actually had an incident where I cut my hand on my birthday playing soccer, landed in the emergency room. And just looking at the healthcare system from that side, from the patient perspective, and being in the emergency room and seeing how a team of healthcare professionals work together for patient care, it just overall got me more interested in medicine as well as emergency medicine. So I think that's kind of the origin story for my solidification of wanting to do medicine.
Yeah, no, that's definitely amazing to be able to hear like how that personal connection, even from very young, was able to ultimately draw you to even the specialty that you're pursuing now. I shared a story pretty recently with another medical student, who I was interviewing, who said kind of a similar thing for his specialty. So it's definitely interesting to see the patterns in terms of that and how a lot of those things can just push you and drive you. So speaking of that entire journey to ultimately applying to emergency medicine, what would you say was probably the most important thing, or one of the most important things you felt like you gained along that entire long journey? Because you've been doing this, 3 years undergrad, 4 years of medical school to ultimately get to where you're at now. So what do you feel like you probably drew the most from all of that?
What I drew the most? What a question. That's a good question. I think what I drew the most from the experience is learning more about the patient experience. Being able to work in hospitals with where a lot of the patients don't have insurance, where they use the emergency room as their primary care physician. It's been humbling to see what people have to go through, what people deal with. People deal with some chronic health conditions that they may not have access to their medications, may not have access to a primary care physician, like I said earlier. So it's just been humbling to see the patient experience and to have that, to develop, a sense of empathy for them, overall to become, a better physician. Because I think being able to understand where somebody is coming from is the first step.
Yeah. So in terms of being able to, on that same point of really being able to look at people really from their lens, especially being like a care provider towards a patient.
Yeah.
Even with the experience you mentioned, like being able to be on that patient side of things. What do you feel like, or rather, do you feel like being able to understand things from the patient perspective, especially because you've been able to be in a lot of different clinical situations, do you feel like that was something that came very smoothly and naturally to you, or do you feel like there were ways where you had to like improve or learn certain things in terms of that area?
I think it came naturally. Like I said, I had to move for school. Living in Harlem, I've done some rotations at Harlem Hospital. So in a way, I've become a part of this community where, I've been living here for so long. So the people that I see in the hospital, it's people that I see around the neighborhood, people that I feel like I know the people that I'm working with. So it's been a pretty natural transition. Yeah, but it's been great to work with, to live in the community that you work in. It's just it's a different experience. It's a great experience.
Yeah, so I guess what I'm also hearing there is like being able to be engaged with the community in general is kind of what also helps you be able to connect even when you have like that white coat or that scrub on.
Oh, 100%, 100%. And the community is like so supportive. Like, I think it was one of my first hospital sessions. I was walking to the hospital and I had my white coat on. It was pretty warm outside, so I didn't have a jacket over my white coat. Yeah. And then just walking, like, it's probably maybe like a 10-minute walk. On that 10-minute walk, the amount of like "I'm proud of you," "Congratulations," "Keep doing your thing" that I got from the community, from just people that I live near, was it was crazy. It was like got maybe like 10, 15 of those in a short walk like that, and it's just it's motivating, and it really helps on the journey.
It's interesting because I feel like a lot of the medical student interviews I've done so far, I keep getting some of that same response of people kind of getting that support like from the community as they're going about their businesses. Like,
because it's something that you feel like you could be having, one of the worst shifts, one of the worst days, and then just, the patient stopping you, giving you a fist bump and saying, "Yo, I'm proud of you." It feels amazing.
It's like the world,
because they don't even know you, and they're like, "Yo, I'm proud of you. You're doing your thing," and it's like you're a part of their family, and it's like, I just met you. It's a different experience.
Yeah, I could definitely imagine. So off of that, speaking, maybe it's a little bit more connected like a medical school journey a little bit, but if I took a moment and brought up like the clinical rotations, you're going through that in like third, fourth year sort of thing. Would you say, or what would you say were, how can I put this without breaking HIPAA? What would you say was maybe, I'll word it this way. What do you think was probably some of the biggest lessons or greatest experiences you felt like you got while being on those clinical rotations?
Biggest lessons. I think one of the biggest lessons that I've learned is take the time to speak with the patients, make sure they understand what's going on. Give you, without breaking HIPAA, I'll try and give you a scenario. So I was doing one of my clinical rotations. I think I was on internal medicine. Yeah. A young woman came in with lupus. We learn about lupus a lot. Yeah. We learned that it can cause like literally everything. Yeah. In medical school. So she came in with textbook symptoms, and we were doing. She had some kidney problems. So we wanted to do a kidney biopsy for her. So I went in to update her because I was assigned to her patient case. I went in to update her, tell her what was going on, and then I was just like, "Oh, like, do you understand like everything that's been happening?" And she's just like, "No." She's just looking at me like, "I have no, like, you guys want to take a piece of my kidney for what?" I'm like, "All right." So I got to sit down with her, talk to her about lupus, and it was good to like see how building the medical knowledge and like the patient care aspect intersect, because I was just able to explain to her what's going on, like why we need to take a kidney biopsy, why whatever's happening to her kidneys is happening, and yeah, it was a point where I learned that you should always ask your patients if they understand, and then ask them to tell you what they've learned, what they understand of the situation they're in, and if they don't understand, take the time to sit down and speak with them and let them know what's going on with their care.
Yeah, so I'm kind of getting a couple things from that. So one thing would be, it's almost like there's that. So I guess there's that barrier, sort of, in some sense of like being someone, especially fresh, like medical student and all those things, and coming into like the clinical world, and then taking what you've learned, and all the different terminology, all the different pathophysiology you had to learn through, and then kind of trying to bridge that gap of presenting that to the patient where they don't have all.
Because all of this medicine, we're learning a new language as we're going through medical school, and then a lot of the patients, they don't speak that language. So you have to take that new language that you've learned and then retranslate it back and be able to put it into terms that the patients will understand, because we just learned these terms. You cannot like expect patients who have never learned these terms to know what they mean.
Yeah, definitely. And I think also a second part to that, one thing I'm definitely getting a lot from that is really, and I definitely applaud you for this, is like being able to really be able to extract the things that you learn from like a textbook and from exams and all of these things that you're learning in order to get through the schooling aspect, and then to take that and to be able to provide the best care and the best education for patients and things like that. I know it's kind of interesting because I probably usually ask stuff like this during interviews, but I do want to ask you. One of the things I definitely think a lot about, even in my journey so far, my first year of medical school and learning all of this new stuff and not really having much clinical exposure yet, is really, really being able to keep in mind that all the things that I'm learning, is not just, to be able to pass my exams and be able to really be the best student I can be, but not only just that, but also taking that information that I'm learning for the exams and all those things to be able to translate it specifically for being like the best physician that I can be for my patients. So what do you feel like helped you to be able to take the things that you learned and kind of have that mindset of not just learning those things for, being able to do well as a student in terms of taking that information in, but also recognizing that it's going to help you in terms of your actual patient care.
Yeah. So I think it doesn't actually hit that you need all of this information to take care of people's lives until maybe when you're in your clinical rotations, because you're going around with the team and you're seeing that you learned about all, like we've been talking about this whole episode. We learned about all of these different diseases and disease processes, and now you're seeing them within a patient, within a human being. So you have to be able to reach back and pull that knowledge and apply it to this human being. That being said, I think what helped me the most is the clinical rotations itself. So I think medical school is designed extremely well, where in the last few years you just do clinical rotations, because I think, well, for my learning style at least, I think I learn best through experience. Kind of talking more about like the last question that you asked me, where I told you about that experience with the lady with lupus. After that experience, every time I see lupus in a test question, I think of her. I'm like,
oh wow,
okay. So learning through experience has been one of the best ways for me to retain the material, and I think it really depends on your learning style. Me, learning through experience is the best way for me to retain information, to do well on the tests, and I think that was I think third year of medical school was great for that.
Yeah. So I want to ask you something maybe a little bit more creative. So if I were to take, because you're in your 4th year now, about to graduate, got one, about to become an emergency medicine, resident. If I were to ask you to take maybe a word for like to represent your 1st year, your 2nd year, your 3rd year, your 4th year in the program, what word do you think you would use for each?
That's a great
and
question.
Why?
That's a lot of question. All right, so let's first year. First year, I would say adjustment as my word. I would use the word adjustment because, coming into it from undergrad, it was an adjustment to see how to learn the different, pathology, physiology, all of those things, and then take a test at the end of the module. So, that was actually first year is, the first time you're introduced to all of these, subsections of what is supposed to be on step 1, pathophysiology, physiology, embryology, all of that stuff. So I'd say it was an adjustment first year for sure.
Yeah. 2nd
year, I don't know. I'm looking for one word. It was a lot of
maybe it's a phrase. That's
it was a lot of ups and downs in the 2nd year. Because you're coming in from your 1st year, you feel like you know what you're doing.
Yeah.
You've learned how to manage the modules and take the exams. You've learned how to do all of that. You've adjusted.
Yeah.
But then there's step 1. And step 1 is a whole different thing on its own. So, going through the whole dedicated period and just studying for that, it can be a lonely time. Not to scare you or anything, but it can be a lonely time. It's a difficult time. But it was a lot of ups and downs, I would say, for 2nd year. 3rd year, let's see, what would I use to describe 3rd year? I'd say fun for 3rd year. I think 3rd year was fun because, I don't know, you come into medical school, people ask you, what specialty do you want to go into? And you just have to say something without even seeing anything, right? So 3rd year is when you get to see every single, not every single, but, some of the 6 of the main specialties that people go into. You get to see what a day-to-day life is on that specialty, and you get to learn more about it. And it's fun because some of the stuff that you're doing in your 3rd year, you're never going to be able to do again. Yeah. Like, I was in the OR on my surgery rotation. I want to do EM. I'm never going to be there again. So it's like you're in awe with every experience that you do. I got to, deliver babies, C-sections. Yeah. Psych. You learn how to interview psych patients. So, and even in all these different specialties, even if you don't go into them, you can draw something from each of them and then, apply it to your own specialty. But yeah, I would say fun for 3rd year. And then 4th year, we're only a few months in, but I say chilling. That's what I would say.
Sounds nice.
Yeah, since, finishing sub-Is and, audition rotations, that could be stressful. But, audition rotations are in the specialty that you want to do. So it's something that you're interested in. So, you're learning more how to be the physician that you want to be, in the next year. So that's great. And then after you apply, applying can be stressful. Obviously, you got to figure out where you want to end up in the next year. So it can be a little bit stressful, all different parts of the application. But then after that, oh man, it feels good. I'm on vacation right now. I just started vacation.
Oh wow!
In the middle of this month, I'm gonna be on vacation until January, and it's just like I'm at home. I'm like I don't know what to do with myself because for the past year, I have to wake up 5 a.m. go into the hospital. There's something to do always. There's always that next challenge. But now it's just like okay, I can relax a little bit. Yeah. And there's a couple more rotations I have coming up.
Oh, okay.
But it's a little bit more chill because I've applied already. It's not in the specialty that I'm applying into.
Oh, I see.
There's still something to learn from those rotations, but it's a little bit more. Yeah. Less. That makes sense. Cutthroat.
Yeah, for sure. So taking a bit of a pivot, if you feel like you haven't already answered this question in full, what do you think were probably the main factors, especially as you mentioned, like when you were younger, seeing, having that experience as a patient in the ER and stuff like that. What do you feel like getting all the way to this point, and especially getting through medical school, really drew you to the field of emergency medicine over all the other specialties?
Oh, okay. This is a great question. I've been answering this question every interview that I've been doing for residency. So I'll give you the residency answer, and then I'll give you the bro answer. So my residency answer is it's three things. So I like the breadth of knowledge and pathology that you have to know about for emergency medicine. You're not just focused on one organ system, one specific body part. You have to know everything. You have to be a well-rounded physician. Second is the range of acuity. So you can see your patient is coming in for, upper respiratory illness, stuffy nose, sore throat, something that's, not too serious.
Yeah.
Then at the same time, in the same shift, you can have somebody coming in respiratory distress, cardiac arrest, coming into the trauma bay, gunshot wound, stab wound, and then you got to run there and, you have to, you got to deal with that. So it's a good change of pace. I think that's something that drew me to emergency medicine. And then the last thing, for my residency answer, the last thing is the dynamic team environment for emergency medicine. So, I think more than any other specialty, the team environment in emergency medicine is apparent. So everybody is boots on the ground. You have nurses, you have technicians, you have PCAs, you have respiratory therapists. Everybody's there. Everybody's working for the good of the patient. Nobody's above anybody else, and it's just dynamic. You could see everybody. Everybody is just in the ER. Almost everybody's like friends, and it's a great team environment. And coming from playing soccer, playing a team sport, it's something that that I saw in emergency medicine that I wanted to be involved in.
Yeah.
So that's my residency answer.
Yeah.
As far as my other answer, I think it's the coolest specialty because people can come in, heart stopped, not breathing, essentially dead, and then you can bring them back. You have to, emergency medicine physicians have to think, what's happening with this patient?
Yeah.
How can I bring them back? How can I save their life? How can I stabilize them and get them to the care that they need? And I think that's great. I also think you're like the complete doctor, like the consummate doctor. Think if something happens out on the street, emergency medicine, you have the skill set, you're equipped to help that person. Something happens on the plane, you can help that person. I think another thing is you're both a generalist and you're a specialist. So like I said earlier, you have to see, a range of patients that come in with different complaints, different body parts, different systems. But you're also a specialist in resuscitation. Yeah. So you have to know ACLS. You have to know what to do if a patient's heart stops. We have to know what to do if a patient is in respiratory distress. You have to know when to intubate. I think emergency medicine is there's nobody else, no other specialty. I mean, this is debatable, I guess. No other specialty that is equipped to handle those situations like emergency medicine.
Yeah, no, you're putting together a good case.
Yeah, you should apply emergency medicine.
So doing a bit of a pivot again really quick. So in terms of, we talked quite a bit about like the clinical experience. We talked quite a bit about just emergency medicine and the style of it and a lot of those different factors. In terms of, again, like your medical school journey, what would you say, whether it's preclinical, whether it's interclinicals, even now, whatever the case is, what would you say was probably your biggest challenge of medical school, and how were you really able to overcome that?
I'd say the biggest challenge was step one, for sure. I think learning how to study for an 8-hour exam was definitely difficult. I mean, you get all of the building blocks and everything throughout, your first 1.5 years of medical school to go and take that exam, but learning how to sit down and just, it's pretty independent. It's pretty self-guided when you have your dedicated period. Yeah. Again, not to scare you. I know it's coming, but you just being able to make your own schedule in terms of studying, and then get through all of that material that you've learned in the past 1.5 years in 6 weeks, and then go sit down for an 8-hour exam is definitely tough. But we did it and we're here. So, but I would say that, and then I know I said third year, clinicals were fun, but it was also difficult. balancing studying for exams and then almost working like a full-time job. It's going to be difficult. You're going into the hospital, coming back home, studying. It was an adjustment. There's definitely an adjustment to be made. It's fun. You're learning on the job, so you're still learning, but it can be difficult.
Yeah, no, that definitely makes sense. And so it sounds like a lot of those things are really just being able to get through like those adjustment periods, when it came to like adjusting to studying for the 8-hour exam, and
Exactly.
adjusting for being able to deal with like the rotations and even like the different rotations and maybe the styles of those as well, like the dynamics.
Medical, it's all the next challenge. Once you finish one, it's like, oh, okay, I can rest now. The next one is coming up. So.
Yeah. So on that point, what do you feel like, or even maybe I should ask this, who do you feel like were probably the main people that were able to help you in terms of kind of that resilience? Because obviously medical school, as I know, to many people is like a very difficult path. It's not an easy one. There's a lot of different challenges, as you mentioned, like the next one that comes after each one. Who do you feel like were the people who were maybe integral to you being able to deal with all of those different pressures?
I think 100% it comes from, through, mentorship, reaching out to mentors, reaching out to other classmates or classmates who are a year above, and just finding out what they did. And even sitting through those group meetings for mentorship and just hearing about the next challenge that they have to overcome and hearing like, oh, okay, like that's the next thing that I have to do. And, just being able to hear what they're doing right now. And that's what I need to be doing, 2 years from now or a year from now.
Yeah.
I think that's been integral, and, just having brothers around you, classmates that you can go to and say, hey, I don't understand this. Can you help me out with this? And then being able to explain it. And then, vice versa. If they don't understand something, you're able to explain it to them and, reinforce your knowledge. So I think, having good people around you, mentors, friends, classmates, I think that's the key. That's the most integral part of succeeding.
Yeah, I can definitely second that for sure. Like, I think mentorship is definitely a huge thing, even from what I've noticed so far. Being able to see people who's like a year ahead, 2 years ahead, 3 years ahead, seeing how they were able to deal with the challenges that came up, and then them even being able to provide some knowledge on how I can kind of work through whatever I have to get done as well. So I definitely think mentorship is key for sure. Yeah, so I think one of the last things I definitely want to touch on, so one of the major focuses of Less Than 3% as a podcast is definitely being able to highlight the experience of being a black man, and even seeing capturing the experiences of other black men who are going through the medical pathway. As when it comes to, and there's a statistic I bring up quite a bit at times. When it comes to all the physicians in the United States, black men make up less than 3% of all of them, which, really inspires, a great amount of this podcast. Yeah. And so definitely one of the things I always want to be able to highlight is really that aspect of medicine and that aspect of medical care, and seeing that number be able to go up. But what do you feel like for yourself is the significance, if any, of being a black man pursuing this medical path?
Yeah. So, like I said, working in this community, living in this community has been great. Harlem is a community of majority Black and Hispanic people. So going into the hospital and, seeing people that look like me and them seeing me and saying like, oh, my doctor is a black man. Oh, like the person on my care team is he looks like me. He can understand, or he'll actually listen to me. He'll actually make some things happen for me. I think that's the main part of it. And I think it's I think that's the main thing. Just being able to walk into a room, people look at you and they feel relieved.
Yeah.
And you can sometimes you can visually see it on people's faces.
Yeah.
And they're just happy to see you. They're happy that you're helping them. And that's all that you do it for.
Yeah. No, definitely. I really think all of that is, hugely important for sure. In terms of just like even the connection with the patients, and kind of having like that cultural competence and like that connection, understanding with patients and stuff like that, and seeing more of that kind of come into medicine. So what would you say, moving forward a little bit, I know we talked quite a bit about, really just your own journey to this point that you're at now, but looking forward, what do you think are probably your major goals, in the future, even past maybe getting into residency and becoming attending and all of that?
I think one of the main things that I want to do is I want to be somewhere where teaching and learning is a priority. So I want to be somewhere where, as an attending or as a leading physician, I'm able to teach residents, I'm able to teach medical students, I'm able to mentor other students. I have a desire for, later, well, even after I graduate residency, being a mentor to some of the students at Sophie Davis. Just overall, facilitating an environment of constantly growing, constantly learning. I think that's what I see for myself. I don't know where I'll be. I don't know if I'll do fellowship after residency or what, but I know definitely I want to be involved in some type of teaching, mentorship.
Lastly, is probably the last question I'll ask. I definitely always want to, especially via this podcast and even a lot of the interviews that I'm doing, be able to kind of give maybe not platform, but be able to provide some of the information that I'm able to get, even just talking to people in this podcast and doing these podcast episodes, really be able to reach out to a lot of, whether it's pre-meds, medical students, people that might be listening who maybe even earlier on, in their sort of path and they're looking at, aspiring to become physicians. What would you, if you could leave one piece of advice, what would you probably say to all the pre-meds and medical students that are looking to ultimately get in that white coat?
I would say keep going. So the theme of this podcast has kind of just been, there's always a new challenge. There's always something that you're going to have to overcome. And I think that you shouldn't stop at one challenge. You should just, find another way to get past it and keep going, because the road is long, the road is winding. But I think now that I'm not even at the end of the road, I'm at like the end of one road and a new road is about to begin. I think it's all definitely, it's worth it. And when you look back, you feel proud of yourself. So I think, just keep going, keep hustling, and, keep good people around you, people who you can go to, not only for, help with classwork, but just to be able to chill with, to unwind with, and get away from school. I think that's the one piece of advice I would give.
Yeah. No, definitely well said. I think really just having that drive to continue to push forward is ultimately, one of the ways you're able to get to that point. You know, as we mentioned, this being, a rigorous path. And so I think definitely having the drive to keep going is extremely important. Yeah. So really with all that being said, that really wraps up, this entire interview now. All right. Is there anywhere people can find you that you want to shout out?
Sure. My Instagram is adi.kaa. I'm really just on Instagram. That's it. Yeah.
Okay, yeah. So again, thank you, for sure for being on.
Thanks for having me on again. It was a great conversation, man.
Yeah, definitely. I definitely feel like I learned a lot. I already know, as I usually end up saying at the end of interviews, like a lot of people watching this are definitely gonna get a lot from it. So appreciate you for it. And so with that being said, that wraps up this episode of the podcast, and I'll see you in the next one.
You want to like, comment, subscribe, or something?
Oh, shit. You're right. I should start saying that. Yeah, definitely. If you have not, like the video, subscribe, hit the bell notifications. There'll definitely be more coming, God willing. So, yeah, again, hope you enjoyed this episode, and I'll see you in the next one.